So that's just to be competent, right? So we're not talking about that. We're talking about ways that we can optimize results. So as surgeons, we look at different ways that are, sometimes we pick our patients and sometimes we don't. Sometimes trauma happens and then you got to go see your doctor, and he's a trauma surgeon and he says, you need surgery and I need to fix this. If you don't fix it, your leg's going to be crooked. You're not going to walk anymore. So you listen to your doctor's advice, right? And so you don't select that patient. But if there's certain things that need to be optimized for that patient, say their blood sugar is 300 when they come in, do you think cutting them open is going to be a good idea? It's not going to heal. It's way too high. So that number is too high to heal. So it wouldn't be a good idea to do surgery. Even if grandma comes in with a hip fracture, her blood pressure is only 65 and she's not able to stand up without being lightheaded. Okay, we got to optimize her heart and make sure she doesn't need some kind of heart procedure, some kind of interventional procedure of her heart, and maybe make sure all of her labs are optimized. Within a day, we can do those things and optimize that patient so that we don't cause harm and kill grandma, right? That's a real thing.
Yeah, we have a 30% mortality.
30% mortality with hip fractures. Just by walking through the door, you have a mortality risk just from having the hip fracture. So that person is already at a very high risk of death, right? So we should agree that if we want to keep grandma alive, we should do everything that we can to optimize her health before we try to, fix her problems.